The ibuprofen question is a tough one. And I think this is one where it shows how we're still learning about this pandemic. If you asked me this question 1 week ago, I would have told you, don't use ibuprofen. And now, a week later, we're kind of thinking, maybe it is okay to use ibuprofen. And it's not because we don't know what the hell we're talking about. It's because data is coming out. As people get sick, as people are treated, we're collecting data on what's working, what's not working, what made things worse, what made things better. A week ago, there were a certain class of medications, as well as ibuprofen, that we were genuinely concerned would make the course of infection, if you got infected, worse. Well, since that point, particularly since our last podcast together, we now know that those certain classes of medications called ACE inhibitors are okay to stay on. If you have a listener who is taking a blood pressure medication called an ACE inhibitor, then it's probably okay to stay on it. But if they're not sure, is it a side effect? Ask your doctor. That's what we're here for. You know, as far as ibuprofen goes, the data has been a moving target when it comes to ibuprofen. 1 week ago, I would have told patients to avoid using ibuprofen for a fever if you think you have COVID-19. Now we're not so sure. Should we use it? Should we not use it? And I think the honest answer really there is that we don't really know. And I can tell you that's the one answer physicians don't like giving people, because we don't know. Because we want to know. We don't like uncertainty. We don't like the unknown. You know, nothing is an anathema to a physician more than the unknown, not having the answer. And I think the ibuprofen issue with COVID-19 is a classic example of that. That what we thought was the case, based on how ibuprofen acts in the body, seems to be not panning out to be as big a concern as we thought. Does that mean ibuprofen is not a concern? No, we just don't know. So I think that if someone told me, oh my gosh, I have COVID-19 symptoms and I took some ibuprofen, well, don't worry. You know, again, it falls under that category of, you know, elements of risk. And when we lack data, we sometimes default to worst case scenarios. And I think ibuprofen in this pandemic was really a big example of that, where we said, wow, you know, just to be on the safe side, don't do that. Now, fortunately, there were plenty of alternatives. You could do Tylenol or whatever the case may be. But I think it just kind of shows that, you know, for all what we know about modern medicine, this pandemic is teaching us a lot of things in the process.